Thinking you might be interested in cardiovascular medicine? Well, there are many career options for you. These three professionals will show you how their careers, while different, allow them to study the same disease in a meaningful way. Dr. Hartman is a medical doctor specializing in cardiology. He diagnoses and treats cardiovascular diseases in human patients, but is also involved in cardiac research. He is going to tell you a bit about the disease. Dr. Hartman says cardiomyopathy refers broadly to a category of disorders involving the muscles of the heart. Dilated cardiomyopathy is the most common of the cardiomyopathies. It predominantly affects the left ventricle, which becomes enlarged and contractility is reduced. This disease results in diminished cardiac output, and the heart is unable to adequately pump blood to the rest of the body, leading to symptoms of heart failure. Up to a third of those diagnosed with DCM have inherited it as a genetic condition. It can also be the result of viral or bacterial infections or drug complications. Patients usually present with symptoms characteristic of heart failure, and a variety of diagnostic tests are available to confirm presence of the disease. So why study DCM? This condition affects 1 in 2,500 people, primarily between the ages of 20 and 60, and is more common in women. It is the third leading cause of heart failure in the U.S. Life expectancy varies, but can be as short as 1 year for 20% of patients that develop heart failure. But wait! Did you know that DCM is also the most common cardiomyopathy in dogs? Dr. Hound is a veterinary cardiologist. His job is similar to Dr. Hartman's, but he deals with animal patients. Veterinary cardiologists treat animals with cardiac disease, including diagnosis, medical therapy, and interventional procedures when available. They are also involved in the training of veterinary students and participate in research. Dr. Hound's research interest is also DCM. In dogs, DCM more commonly affects large breeds like the Great Dane, Irish Wolfhound, and Doberman Pinscher. In the Doberman, DCM is predominantly a heritable condition, and up to 60% of Dobermans may be affected in their lifetime. Although veterinarians do treat animal patients, they also can use their patients like the Doberman as a model to study the disease. Advances in this field can benefit not only dogs, but people with DCM too. Of course, clinicians are not alone in their desire to study cardiomyopathies. Meet Dr. Smith, who has a PhD in molecular biology and is interested in studying DCM at the molecular level. Scientists in Dr. Smith's research group investigate the genetics of DCM, both humans and dogs, and look at the molecular changes that occur in this disease. A recent study conducted by scientists like Dr. Smith investigated a specific energy substrate called deoxy-ATP. They found that this substrate was able to substantially improve contractility of myocardial tissue from Dobermans with DCM. Possible future directions from research like this could involve in vivo studies using the Doberman as a model of disease and would require clinicians like Dr. Hartman and Dr. Hound to implement clinical trials. This type of research has the potential to benefit both dogs and people alike. Pimobandan is a drug that may help increase contractility of the heart in DCM. Human clinical trials have been halted, however, due to high risk of cardiac death. Dr. Hound, however, commonly prescribes Pimobandan to his Doberman patients, as this drug improves outcomes of patients with DCM when treated before and even during heart failure, with no increased risk of cardiac death. Dr. Hound and Dr. Smith may work together to determine why this drug is effective in dogs and how to make it safe for humans. Stem cell therapy is another topic of interest among cardiovascular researchers. This treatment has been shown to reduce scar size in human patients following myocardial infarction. A group of scientists and veterinary cardiologists recently investigated intracoronary stem cell therapies in Dobermans with DCM, and the results suggested that this might be a safe and effective therapy for them. Might this also hold promise for human patients with DCM? Currently, we know a lot more about the genes involved in human DCM than in the Doberman. In terms of prognosis, cardiologists continue investigating various diagnostic modalities to estimate their patients' lifespan, and research continues into the use of both previously known and new therapies for the treatment of DCM. We hope that you have gained some insight into the exciting world of cardiovascular medicine and research, and all the opportunities available to you. Thanks for joining us.
Created using Powtoon.